So here's a video on exercises and stretches after an ankle sprain. So first and foremost, we have to get your ankle moving after an ankle sprain. Research shows that the most important thing is regaining range of motion and stimulating mechanoreceptors in your ankle. Ankle cars are a great way to do this. What we're trying to do is dust off the cobwebs in those corner motions or kind of some end ranges that you haven't been in since the ankle sprain. If you have pain in a certain one of these positions, just treat it as a speed bump and go around the speed bump or the pain area. So what I'm doing here is I'm taking the ankle, just the ankle joint, isolating out the ankle joint into dorsiflexion, inversion, plantar flexion, and eversion, which is basically toe up, ankle, bottom of your foot in, toe down, bottom of your foot facing out. Should be a really good pain reliever for after an ankle sprain. You can start doing them literally immediately after an ankle sprain. Second thing we always recommend is compression and elevation to help with swelling. So you can utilize a wrap, any type of wrap, an ace bandage wrap. I'm utilizing a voodoo band lightly here for compression. You can get any type of ankle sleeve, but utilize compression and then elevate. While you're in that position, we want you to be active, so doing some ankle pumps throughout as you're hanging out, maybe with it elevated for 10 minutes or so. If you are utilizing the voodoo band, just do a few minutes of it with the ankle pumps, and it should be a good pain reliever as well. So we moved it, we've done compression and elevation. Now we want to start getting a little bit more active with some single leg drills and just getting proprioceptive feedback through your ankle. So this is a single leg balance drill. If you're in pain with this, you can put more weight through the right leg. So I'm toeing down, kickstanding with that back leg. Or if you're feeling pretty confident, you can go up in a single leg stance. You can also add a pole or something to hold on to a chair as you're doing the reaches if it's a touch painful. But we got to initiate movement after an ankle sprain. A progressed exercise here, so maybe you're a few days after the ankle sprain, you're feeling pretty good, swelling's gone down, it's just a star excursion drill. Think driving your big toe into the ground, giving yourself an arch, and being strong on the hip on that stance leg as well. So we're reaching a few different directions, forward, lateral, reverse, and at a transverse kind of posterior lateral direction. Now we'll do a heel raise on a towel with a ball squeeze. So with this, with the ball between kind of those two pointy ankle bones on the inside of your ankle, you're going to squeeze the ball, which will activate your posterior tibialis muscle, give you an arch again, and then do the heel raise. We add in the towel to get a little bit more depth, or that negative aspect of the motion through the calf and heel cord. Good for intrinsic foot strength, which is a major component in chronic ankle sprains or chronic ankle instability. Here's a different angle. You can see the ball squeeze initiated, which gives you an arch, and then going through the heel raise for calf activation. Next one here is just a banded squat drill. We want to get some glute activation after an ankle sprain. A lot of times any ankle sprain will find a unilateral weakness or a one-sided weakness in hip external rotators or glute max. So this is a major component on mitigating chronic ankle sprains or decreasing that risk for future ankle sprains is through glute and core strengthening along with your isolated ankle intrinsics. We'll finish up with a fun one here is toe cars. So we're trying to isolate out intrinsics in the small muscles in our foot and ankle. What we're doing here is you're lifting just your big toe up while pressing through the ground with the four other toes. So we see that here. And then we'll press down into the ground with your big toe as you lift your four other toes up off the ground. It's surprisingly very hard, and there's a lot of people that cannot do this, but it's greatly important for feeling the ground and getting that sensory input, which can decrease risk for ankle sprains in the future.